Semprex-D is a combination medication used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines in this medication help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing, while decongestants help to relieve stuffy nose and ear congestion symptoms. If you are self-treating with this medication, carefully read the package instructions to be sure it is right for you before you start using this product. Some products have similar brand names but different active ingredients with different uses, so taking the wrong product could harm you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years, so it's important to ask your doctor or pharmacist for more details about using your product safely. It's important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions and do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Semprex-D, make sure to follow the instructions from your doctor or on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. If you experience stomach upset, you can take this medication with food and make sure to drink plenty of fluids, unless directed otherwise by your doctor. If you are using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon and shake the bottle well before each dose if it's a suspension. For extended release tablets or capsules, it's important not to crush or chew them. If you are using chewable tablets, make sure to chew thoroughly before swallowing. If your doctor has prescribed this medication for daily use, take it at the same times each day to get the most benefit from it. Remember to inform your doctor if your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, fever, or rash. These could be signs of a more serious medical issue and should be checked by a doctor. Some common side effects of Semprex-D may include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. However, many people using this product do not experience serious side effects. If you do have any serious side effects, such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes, it's important to inform your doctor right away. In rare cases, a very serious allergic reaction may occur. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects. Remember to follow your doctor's directions and consider the benefits of using this product. If you have any concerns or questions, don't hesitate to talk to your healthcare provider. Before taking Semprex-D, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history, especially if you have breathing problems, diabetes, heart issues, high blood pressure, kidney or liver problems, or any other health conditions. Semprex-D may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana while taking this medication. If you are using marijuana, talk to your doctor. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit sugar, alcohol, or aspartame in your diet, consult your doctor before using Semprex-D. It's also important to inform your doctor about all the products you use before having surgery. This medication may have different effects on children and older adults, so it's crucial to discuss any concerns with your doctor. If you're pregnant or breastfeeding, consult your doctor before taking Semprex-D. It's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Semprex-D are antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. It's important to avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Make sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Always check the labels on all your medicines, including allergy or cough and cold products, because they may contain ingredients that cause drowsiness. Additionally, Semprex-D may interfere with certain medical/lab tests, such as brain scans for Parkinson's disease, urine drug screening tests, and allergy skin tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Semprex-D and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If you or someone you know is experiencing these symptoms after taking Semprex-D, seek medical attention immediately. Remember, if your doctor has prescribed Semprex-D for you, it's important not to share it with others. It's essential to attend all medical and lab appointments as instructed. This medication is used to relieve symptoms of hay fever and other respiratory allergies, including sneezing, runny nose, and itchy/watery eyes. It works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. The recommended daily dosage is usually once a day, and it's best to take it at the same time each day. It can be taken with or without food. Be sure to follow your doctor's instructions carefully for the best results. If you forget to take Semprex-D on your regular schedule, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to take Semprex-D as directed by your doctor for it to be effective in treating your symptoms. Make sure to store Semprex-D at room temperature, away from light and moisture. It's best not to store it in the bathroom and avoid freezing the liquid forms of this medication. Keep all medications out of reach of children and pets. When it comes to disposing of Semprex-D, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's important to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Semprex-D. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.